The end is yet to be heard on the fatality of Lassa Fever in Nigeria. Few states have recorded its share of the fatality cases, including the Federal Capital Territory. However, the Department of Public Health (FCTA) is not leaving any stone unturned in the containment of the viral disease. Also, the internally displaced persons camp in New Kochingoro FCT has been left without a standby health facility, leading to health risks such as breeding ground for mosquitoes, among others. That is our package for you today. Welcome to your health program showing on the Unity Station, NTA Channel 5 Abuja. My name is Deborah Nimi Usman. The department that is responsible for public health in FCTA has recorded success in containing Lassa fever in FCT. Let's hear what the department has to say about Lassa fever and its success story.
Why is Lassa fever prevalent now?
Communicable diseases, they have season. This is the season, such a disease like Lassa fever, you see a lot of it. Because we are entering farming season, people do bush burning, and when this happens, we chase them out of their natural habitat and they start moving around the houses, especially where they find food. You see them scavenging for food around the coast. So it's usually between October to May to April.
What is the cause of Lassa fever?
You know, it's an acute viral illness, which is very common in West Africa. The carrier of the Lassa virus is a rodent called natalensis. It's a multi-mammal rat. I don't think there's any rat with such number of mammal plants. It shares the virus, its urine or droppings, and when this contaminates objects or materials around, and somebody touches that or eats the food contaminated with the urine or droppings of this infected rat, certainly the person is likely to come down with the disease.
What are the symptoms of Lassa fever?
There are minor symptoms and there are major symptoms. The minor symptoms include fever, headache, retrosternal pain, that is pain behind the chest wall, abdominal pain, body pain, you have vomiting, you can have diarrhea, you can have conjunctivitis, you have protein in the urine, proteinuria. These are minor symptoms. And then if nothing is done, it can get bad. You start having bleeding, could be bleeding into the gum, through the orifices, into the subconjunctival hemorrhage into the eyes. You can have bleeding from any from needle puncture or somebody have an injection. See on bleeding coming from there. And then one of the complications, you can have things like deafness, and then in the first trimester of pregnancy, it can cause spontaneous abortion. Particularly when there's bleeding, the person can affect the nervous system, tremor, because of function, and the bleeding could be from any orifice in the body. I think that's the classical major symptom. Then the conjunctivitis and the conjunctivitis jaundice can come because it's a multi-symptom disease. It can affect many organs. That's what I mean by that. And then if you check the liver enzymes, they will go up. If you do blood count, the platelet count will be low. So when you have this, and then that person must have been treated for common cause of bleeding stage, and you see the liver enzymes are strongly high, the chances are very limited.
What is being done to ensure Lassa fever does not become an epidemic in FCT?
Well, we had the first major outbreak of Lassa fever in 2009. At that time we had 20 suspected cases, 8 tested positive, and 5 deaths. So, the experience we gained from that one, when it started happening all over the country, we knew that certainly Abuja may not be free of it. Bearing in mind the point you raised, we are surrounded by 5 states. And in fact, before this time, those states have recorded cases. So we started early. Based on all this, we didn't wait for a case to be suspected or confirmed in FCT before embarking on measures meant to prevent the spread of disease in FCT. So we started early with engaging relevant stakeholders like the area council, the health educators, engage them to work on social mobilization, health education, on risk factors and ways to prevent it. We engage the surveillance officers, the disease control officers, the area councils to widen their search, their scope, and intensify active surveillance and active case search. Then we also engage clinicians, which include medical doctors, pharmacists, nurses, laboratory scientists, in the public and private health facilities in the city, sensitizing them on Lassa fever outbreak. Most of these things we did before we recorded the first case in the city, and it's ongoing. We have other activities lined up, being supported actively by the minister and the stakeholders in the city.
Are people more aware of Lassa fever?
I can tell you with certainty that the people are now aware, majority, let's say majority in the city, especially the rural communities, they are aware of the Lassa fever situation. They are aware of what you can, how they can get it, they are aware of what they can do to prevent it, and they are aware that if they fall sick, they have to go to the nearest health facility, be it primary, secondary, or tertiary, the ones closest to them. And I can also tell you that the situation now is not like in January. We're not getting so many rumors again, we're not getting so many calls again, meaning that we don't have much suspected cases, meaning that the containment is succeeding. Containment efforts, we are succeeding in that area.
What is your advice to the public?
The environment, clean environment starts with you and I. If everybody try to do his or her own bit, everywhere we clean. We might not have need for a whole day of environmental sanitation. So, and then the best thing to do is to keep your surroundings clean. All those things that you think you know that will attack that to your house or your kitchen or wherever you try to remove them. And then make sure that you cover your food. Those that spread cassava or whatever on the roadside to keep it dry. Of course, these plants go there to feast. And if there is infected rat, the urine or drop is contaminated. So those things should be avoided. And even those that you eat rat, they also advised to refrain from that. Compare you cook it well, there's nothing like cooking it well. It's absolute abstinence from that eating. So essentially those are the things you need to do. Keep your surroundings clean, cover the food you have in the house, and then you can get the rats trapped. We only use the population, not like you can eliminate or eradicate that species of God's creature.
We say kudos to the Department of Public Health (FCTA) for such a great effort in protecting lives in the Federal Capital Territory. Unfortunately, the IDP camp in New Pitangoro has been left without any standby medical facilities. This picture tells us more on the ugly situation in the camp.
The outbreak of insurgency in northeast Nigeria has created social challenges. About 3,300,000 people are currently displaced by the conflict in northeast Nigeria. New Kuchingoro is one of the 3 internally displaced persons camps in the Federal Capital Territory. In New Kuchingoro camp, life is a shadow of itself. It has remained a mirage. The absence of stable health facility in New Kuchingoro puts the lives of the displaced persons in danger. New Kuchingoro has about 900 inhabitants who were displaced from Goza in Borno State, Bogoro in Bauchi State, and Kaduna State. Women and children make up 80% of the inhabitants in New Kuchingoro camp, which means there will be an increase in childbirth.
If there's any need for admission and stuff, take them to a hospital where they can get that kind of care, because the camps do not have a hospital setting. So the best to do, we can get as close as possible to what is attainable in a clinic, see them, and where special treatment is needed, we take them out there. And for family planning too, it's the same thing. We try to enroll them into family planning, so at least that can curtail the birth rate in the camps.
According to a United Nations Population Fund UNPF report, by the end of 2015, about 6,000 new births would have been recorded in the IDP camps. The increasing figure in human population has serious health challenges.
One thing that stands out is you find cases of malaria, which is expected because of their poor standard of livings. I mean, they're exposed, and the environments aren't exactly well kept. So yes, you see a lot of cases of malaria, and then because of the cold weather and stuff, also you see respiratory tract infections. Various are ranging from the upper respiratory tract infections to lower respiratory tract infections. And then you find them skin conditions like teniasis because of their poor the water supply. Some of these camps are not good water supply, so you find some skin lesions there. So basically, from our work with them, these are some of the commonest complaints and diagnoses we've made: malaria, respiratory tract infections, and some skin conditions.
Since majority of the inhabitants in the camp are farmers, lack of employment for able-bodied men is causing serious malnutrition and stunted growth in the children.
If you throw a question out in the camp and you ask them what they really need, you'll be surprised at what they'll tell you. Some of them tell you they want to be able to enroll in antenatal care. Some of them tell you they would like to have men in trade so that they can, take care of themselves, fend for themselves. I mean, most of these people are farmers, so at the back of their mind, they are here now. They've lost their source of livelihood and they need another source of livelihood. If you ask me the needs now that this activity, I will tell you that most of them need some form of occupational rehabilitation, because it's important. Once we can get them something to do, they can make a living for themselves, earn some money, and then they can take care of their basic needs like feeding, buying clothes, buying toiletries, and all this. When you look at all of this, they ultimately leads to a better health for the IDPs.
6-year-old Daku Moses can no longer feel the comfort of the environment. In her bewilderment, she looks abandoned and unkept. With thriving malaria parasites, cold, and cough are some of the common illnesses in the camp. Children under 5 years are the worst hit by these diseases.
Like any community or society without a healthcare facility or a healthcare system in place, the complications that can arise are you could have mortalities from conditions that could easily be preventable, especially there are conditions that could be arrested quickly if there's a nearby primary health center or hospital.
Water is a luxury with only less than 40% displaced persons. This water hardly flows due to lack of electricity to channel the water for storage.
The water is not enough, and it has affected the health standard of the camp, because we have a toilet and the toilet cannot be washed due to the scarcity of the water. The women that we assign them to wash the toilet are saying that they don't have the water even to drink. The water is not enough for them to drink. The place of them taking the water to wash the toilet. Before we can wash the toilet, we have to ask those that are washing clothes to gather the water, though it is not enough. You cannot be supervising somebody that is washing clothes to take the water and go and wash the toilet. Had it been that the solar can pump the water to fill these tanks, then the problem we can mitigate that problem as zero as possible. Then we can have the water, because the solar one, once the water has gone down, we don't have inverter and batteries that will save the charges. Once the sun has gone down, the water will stop, and once the sun rise up, and the water will start pumping around 10 or 11 before to the evening. The water will not go around. We plead if the government can help us, or individual can help us to assist us with the inverter and battery, so that we can use a power saving energy that can save, even if the sun goes down, the power that will be generated from the sun.
In 2015, about 16 babies were born in the camp, mostly through traditional method. Naomi Ishaku is a traditional midwife who now helps pregnant women to deliver their babies in the camp.
Gaskiya na taimakawa mata na da shekara 13 a bana na karɓar yaro.
It is true that for the past 13 years, I have been rendering the service of a traditional midwife to the people. Apart from the delivery of the baby, I cut the umbilical cord between the mother and the baby. I also visit the nursing mother and the baby regularly to make sure both of them are in good health.
Na je ku ci gora ka tura ni wani asibiti. Daga tura mu wani asibiti kuma aka ce sai tiyata.
I went to the hospital. They said they were going to operate me, but they did not. On my way, I delivered my baby at Iran between the bridge and the shopping center. Later, I was taken back to Kuchingoro for them to call the umbilical cord. For Kuchingoro, I was sent to another hospital at Airport Road because my baby was not feeling fine. It was at that hospital that my baby got well. I used to go to that hospital for drugs, but whenever I go there, if there was no drug, I would use my money to buy drugs. I used to borrow money to buy drugs for my baby.
Zam je mu karba mata, ana ringa bata magani dai.
An babu a ofisin ku ba fa.
Sai mu je mu nemi ko da kuɗi ko aro ne za mu yi ma, sai mu je mu saya mata magani.
Despite the fact that the threat posed by the insurgency is fast fading away, one cannot tell how soon these people will return to their homes. However, lack of stable health care center in the camp may trigger an epidemic anytime soon.
It's a pity these persons have been left uncared for. However, they are begging for at least a mobile healthcare facilities to be placed in the camp. Let's take these tips on anti-mosquitoes.
Mosquitoes are responsible for hundreds of millions of malaria cases each year. The transmitter host of other diseases such as dengue fever, yellow fever, and West Nile virus. Having a mosquito breeding site around your home makes you vulnerable to a host of diseases. The following anti-mosquito measures should be taken. Properly dispose or discard containers. Example, soft drink cans and lunch boxes. Tightly cover water containers. Change the water in vases every week. Clear the water in the sources under the potted plants weekly. Keep all drains free from blockage. tires properly or puncture them to prevent water trapping. Clear refuse and fallen leaves inside drains and surface channels to prevent blockage.
That is how far we can take you on today's episode of the program Your Health. We hope to bring you more interesting health education next week and on the same station. Remember, your health is your wealth.